July 2023, we spoke to local people about using digital methods to access health services and asked them what benefits, issues and what more the NHS need to do to help people. Since then, lots of great collaborative work has been undertaken with people and communities to enable us to listen to, understand and to work with communities to transform digital access. Our approach to working with people and communities and the contribution that our voluntary, community, faith and social enterprise and trusted voices make is key to this. This video highlights some of that work and the impact it can have on the health and happiness of our people and communities when we start with people, recognise the strengths of our people and communities and shift to recognising what matters to people rather than what's the matter with them.
Our Black Country Connected programme is helping to support people to become more digitally inclusive and get online. We provide a laptop, connectivity and training as well as ongoing support. We started the programme in July 2022 and since then we've worked with over 190 diverse community groups across the Black Country, and what we've realised is that one size doesn't fit all. Everybody has different and individual needs, and it's really important that we listen to these needs. We just don't expect people to keep coming to us, we go out to them, and that's exactly what the programme has done. Part of our digital inequalities work has been looking at barriers people with sensory impairments face when accessing their GP practices and surgeries. Members of the group have been from our local visually and hearing impaired communities, and this is a space that we're really hoping that will lead to positive change driven by local people and communities with lived experience.
This working group is important because there are so many different voices that we can hear from in the group. I represent the deaf community, so it's not just me. It's people from the deaf community that come from various backgrounds. You know, everybody has their own different living experiences. We're not all the same, so it's important that we get their experiences as well, and that we can see how we can work together on this, and to make sure that their voices are understood and heard, so we can create access to information and how we can adjust it to make sure that the deaf community has, you know, an aim, a target to what they can understand, like what is digital access and what it means to them. We want to make sure that people making decisions, we want to make sure that we've provided for these communities. So using their lived experience, like growing up in a deaf family, we didn't exactly have immediate access. It was difficult. You know, it's like my family we weren't exactly healthy because we didn't really have access to information.
Hi, I'm Dave. I'm a youth and community worker working with families that are often lonely and isolated, and individuals who are maybe have anxiety issues, lonely, isolated, depressed. And I put on programs and activities to help reduce that. It could be walking groups, art and craft groups, cycling sessions. I've done many things that have brought people together, and from there I've used it as a way of being able to educate them on their well-being. So I've shown many people in groups how to use the NHS app, how to use the website, how to order prescriptions, how to check appointments, how to make appointments, all sorts of tools that are available through the NHS portals. It's important that we listen to people because often they will find their own solutions, and I want to give them the tools to take control positively of their lives. So I look forward to this initiative and I can't wait to be part of it.
The last course, the last training we've done at Grey Heart, they helped them a lot. They feel more confident. They increase their confidence when they know they can have support from a community. They need to for example, to do something with bus pass, they're not able to do it by themselves, and then we can help them. This course is going to help them to do their issues day by day. For example, like find a job. If talking about the NHS, if they want to order a prescription, to book online an appointment, it's going to help them a lot, and they feel very confident when they can do this all by themselves. And we teach all of this there when at Green Heart. It helps them.
So sort of that community integration, but through digital avenues, is, I think it was great. Google Maps, using Google Maps, knowing where to go, using buses, which bus can I take. So we also had a program that you supported on for bus passes, where we had to register them to receive Swift cards from National Express. So most of them would do that, but because they have had these training, digital training skills, they sort of became confident in registering for those buses, because everything is pretty much digital, and if people don't know how to use, they are left behind. During these programs, we focus more on who they are as individuals, not what's wrong with them. And I believe that all these 12 people that you supported, you didn't understand them from a mental health point of view, but you understood them from individual point of view and what they could do. I think it's really important that we've seen our community, improve in so many different ways. As I say, we're no longer defining them as, mental health patients. We see them because that confidence in doing things for themselves has improved.
In my role, I use my personal experiences to help improve NHS services for people with similar challenges. One of the key things that has transformed both my role and my life as a patient is the move towards digital access. Being able to view my test results, book appointments, and manage prescriptions online has made a huge difference. It not only saves time, but also gives me more control over my own health. As an LEC, having access to digital tools has been absolutely essential. I was thankfully provided with a device upon succession of my application, which has really enhanced my ability to connect with colleagues and service users. It's allowed me to stay informed and actively involved in consultations and meetings, even when working remotely. Digital connectivity has also opened up new opportunities for me beyond NHS services. I've been able to engage with communities of people who share lived experiences, which has been both supportive and motivating. It's given me a space to share insights and collaborate with others in similar roles, ultimately helping me to be more effective in shaping services that meet the needs of patients. Access to digital therapies, such as cognitive behavioural therapy, through platforms like SilverCloud, as well as attending counselling sessions online, has completely reshaped how healthcare is delivered and received. These services have expanded access to mental health care, offering flexible and personalised support that can be accessed from home. This shift towards digital therapy not only makes it easier for patients to engage with mental health services, but also ensures that more people can receive timely care, irrespective of geographical limitations. Without digital access, I honestly don't think I could carry out my role in the same way. It's given me the flexibility and the tools I need to be a part of important conversations that directly impact the way healthcare services are designed and delivered.
I can feel their commitment.
The commitment was really good.
Because, they want to achieve something for themselves.
And after that, the impact has gone on, that now we have some of the people that you taught actually become mentors. You can see them helping other people.
One of the partnerships we've built is with Penn Residents Association in Wolverhampton. And we know that Penn is one of the most digitally deprived areas within the Wolverhampton borough, which is why it's equally important to support and build these good working relationships to support the local residents. Penn Residents Association have built community hubs which are working really well and allows people to attend to get advice, help in a way that's suitable to their individual needs. One of their community hubs is the local news agents who are supporting people with digital devices by the programme, and we've been able to respond to the community intelligence from Penn Residents Association about the news agents and work with them and setting up a workable method through good working partnerships as well as other organisations, and being led by what communities want and what they need.
Our digital team continues to build partnerships with trusted voices and local community organisations by responding to and being led by what they're hearing by starting with people. The team is also liaising with the working group with the hope it will lead to people leading the change and that the system adapts based on what we're hearing from people and communities.